the best 12 seconds.
It was actually one of my jokes.
Yeah, I got
So you're going to look at me instead of the...
Yeah. Okay.
Are we ready?
Yep, we're rolling.
Okay, so first just introduce yourself.
My name's Doug Alder. I've been around this campus for 30 years. That's all you need to know.
Yes?
I'm a historian.
Great. Can you tell us what was healthcare like, just a brief overview of what was healthcare like here in Washington County prior to 1913?
Prior to 1913, first of all, you need to know that it was a small population. 6,000 people, 7,000 people in the whole county. And people lived in villages. And there were about 150 people in a village. They had to take care of their own health care because doctors were, if there were any in the county, which there might have been one or two, they weren't close by. And so health care was essentially based on herbal medicine. When the people arrived here, they brought the American culture with them, and the American culture was based on herbal medicine too. So people had their favorite herbal remedies. But when they got here, they didn't have the herbs, if they came from Wisconsin or Minnesota or wherever they came from. But they knew what they wanted. Well, the people who knew herbs were the Paiutes, because they knew what grew here, and they had been here for 700 years, and they had become... Because they survived, they had to be experts in herbal medicine. So they traded with the Paiute women. The Paiute women were the one that went out and gathered the herbs, and they knew most about it. But they also had religious shaman people who gave blessings and had rituals. So they did both, and the Mormons did the same thing. They did herbal medicine, and they had prayers and blessings and so forth. Okay, so medicine was largely in the hands of the women. Now, the reality of it is that birthing was probably the most crucial, immediate thing. And a lot of babies died at birth or shortly thereafter. If they could get alive from birth, they could generally get through the first year because they were nursed. And then after the first year, they were likely to get sick because the people that were here, including the natives, didn't know about germs, and they did not understand that water was the problem. Water was where the germs came along. So when a child is 1 year old and you quit nursing, it goes on to water and starts picking up the kinds of things that had. And so they had various diseases. Measles were very bad. Whooping cough was the one that just really was tough. 1918, you'll remember, was the flu epidemic throughout the world, and flu epidemic was tough here. So what I'm saying is there was a lot of deaths. But interestingly, the deaths weren't just children. Parents, it was not unusual for a mother to become very sick by the time she was 28 or 32. A father might die young because there was all kinds of accidents. There was nobody to set bones. And so, here's one of the big jokes. One of the special people that set bones were school teachers. And I have records of 425 people that were interviewed and were born around 1900. And they tell how they handled medicine. And they borrowed from the Indians, and they used herbal medicine, and they gave blessings, and they set bones and all kinds of people, and they pulled teeth out with pliers, and life was pretty tough. Well, along came the Thomsonian doctors. And when the pioneers came here, there were Thomsonians that came with them. And Thomsonians were simply herbalists who became very specialized in herbal medicine and who subscribed to Thompson. Thompson published a book in Massachusetts with all kinds of herbal remedies. And they became not full-time doctors. They couldn't make a living at it, but they became the specialists. And there was a famous one up in Leeds, and there was one in Tokerville, and there were two in St. George. And so people would turn to the herbalists and go and pay to get help with those. And they would have some medications, but mostly they had made them themselves. Okay, so then come the surgeons. Surgeons are people who had gone to medical school. And there weren't very many medical schools, and they were all in the East. And so you start getting your first medical doctors who came here. There was a Dr. Affleck, who was here in St. George, a Dr. Cliff, a Dr. Woodbury. They get here maybe 1905, 1908, something like that. And they start invasive surgery. They start cutting into the body. But the most famous thing that they did all over the nation, same here as elsewhere, was that they believed that disease was spread by the blood. And so when somebody had a disease, they would draw the blood, and they would take 3 pints of blood out of somebody on the theory that the less blood that was moving through the body, the less disease would go through the body. Well, of course, the herbalists and the general public became very suspicious of that. But then eventually, of course, they get into actual surgery. And they start going in and taking out an appendix or taking out tonsils or doing things of that nature. And that's when the McGregor brothers come. There's 3 McGregors that come in generations. And once the doctors of course, they come to St. George, not to Enterprise, and though there was an herbal doctor up in Enterprise. And so once they get here, the doctors have got to have a surgery room. And so the Dr. McGregor and Dr. Woodbury decide to build a hospital. Now, a hospital is simply a room where you do surgery and some recovery rooms. And they had access to a house right in the middle of downtown. It's where the telephone company is now, and across from the old post office, right there on Tabernacle and First East. And it was, when we moved here, the house was still there. And they opened a hospital. And it had 4 beds in it, plus 6 recovery rooms, and a surgery room, and a dental office. And that became then the headquarters of the new medicine for the whole county. Now remember, there are 40 villages in the Dixie area, and then 1 capital city. Half of the people live in the capital city of St. George. So those in St. George will have access to medical doctors. Eventually, there will be a doctor in Harrison. You notice I pronounced that correctly. And so now these doctors, McGregor, practiced in their hospital. The other doctors end up going out to the people. So shortly after the McGregors get going, Dr. Reichman comes. And Dr. Reichman ends up being the specialist, not surgery, birthing, general family medicine. And the same out in Harrison, and then eventually there'll be one in Enterprise. Those doctors, you just need to read their life. Oh, man, they are on the go all the time. People send messages by telegraph or occasionally a telephone, and they have to go long distance, and sometimes in the middle of the night. I have to go up to Virgin or Springdale, and I have all kinds of accounts of how they tried to get them there. But, again, the people didn't have any money. Now, $5 is what a doctor charged, but $5 was an awful lot of money. And Dr. Reichman, I think you've heard the story, never sent anybody a bill. His nurse typed up the bill, but he just depended on if they had enough money, they would come and pay it, and if they didn't, he didn't send it to them. When you think of medical practice today, our medical doctors practicing in group medicine, those doctors all practiced by themselves. They had to respond whenever it was. So they were 24 hours a day, 7 days a week. Whenever they were needed, they had to go. It wasn't that you went to the doctor. At least half of what he did was going to the patients. And they started to bring some medications. There wasn't a lot of production of medicine nationally that was available. So it was pretty limited. I've told you more than you want to know.
Okay. We want to focus a lot on the hospital. So, can you tell us a little bit more about the McGregor Hospital? What it was like to be a patient there? What kinds of things they did there?
Well, they did do birthing there. But mostly it was surgery for broken bones and for organs that were deficient. And, of course, they couldn't refer anybody. There was no air flight to Las Vegas. Las Vegas was 100 people at the time. Whatever medicine was done had to be done right in that hospital. You certainly didn't send them to Cedar City. You might possibly send them to Salt Lake. And 2 or 3 of these interviews that I'd done, they did actually send a couple of people to Cedar City, and then Cedar City would send them to Salt Lake. But that was because there was a railroad. But almost everything that was done in that one house. And there were 2 generations of doctors there. And so, most of the problems were operating on organs, lungs and stomachs and all kinds of liver problems and all those kinds of things. Plus, of course, setting bones, all of that kind of stuff.
Okay. Can you talk a little bit more about what kind of an experience could a patient expect going to the McGregor?
One of the most important things about the hospital were the nurses, because the doctors did the actual surgery, but the preparation and recuperation was dependent upon nurses, and you had to have nurses there 24 hours a day. And one of the things that's very interesting about the whole history of medicine in this county is the stability of the doctors and nurses. Many of them spent 40 years in their profession. Mrs. Hafen and all these other nurses stayed at it for decades, and they made practically no money. It was really, the wages were $1.40 a day, and it was a pretty modest thing, but it was a mission as far as they were concerned, and they had a great collegial relationship between the doctors and the nurses. And the nurses were the ones that the people really related to, because they didn't see the doctor an awful lot. They needed the doctor, but it was the nurse who worked them through. Then eventually nurses will expand beyond the hospital, and you'll have county nurses. And they're the ones that go out. And you guys don't remember this, but I can because I'm really old. But if a person had the mumps or whooping cough, they were given a sign to put in their window, and they were confined to the house, and no one was to go into that house. And so the nurses, the county nurses, worked very closely with the schools. And all of the students were examined to see if any of them were getting mumps or anything like that. And then they were confined to homes. And then the nurses would go to the homes and work with the parents. And so nursing was able to get out and do those things, but mostly in St. George. Didn't happen very much in the villages. But also in the hospital, the nurses were just very, very important. There were 5 nurses in the McGregor. It may have been 6. And that had to carry the whole 24 hours. So.
Okay, great. Can you talk about how it evolved over the years during its lifespan?
Well, sitting back where we are, you could just say in a cool way, it grew as the community grew. Well, that's way too simple. If you had 4,000 people in St. George, well, about 3,000 people in St. George, and another 3,000 to 4,000 in the rest of the county, what happens when you have 5,000 and 6,000 people in St. George and 5,000 and 6,000 people in the rest of the county? And then what happens when you get up to 20,000 people in the whole county? Well, as that happens, then the need to expand the hospital becomes very clear. And it was the McGregors who saw they had to expand that hospital, and the building wasn't expandable. It was in limited space, but they had more surgery than they could do. Well, what are you going to do? They had a private hospital. You have to take your hat off to the McGregors. They wanted to give it away. They could have said, let's go build another hospital, let's find some capitalists, and let's build another hospital and get our services up to double what it is. But they said, no, this growth is going to continue, and we need to think about another solution. And so they talked with leaders in the community, and finally the decision, it was a very complex thing, but the decision was made that the county would take the leadership. They would need to get resources from the state. They would need to get some resources from federal government. But they decided to build a bigger building on a site where it could be expanded and expanded and expanded. Now that's called vision. And that county commission was very smart, because when it had expanded 4 times, they said, we're in this thing over our heads. We got to find somebody who knows how to do this. So anyway, they built the Pioneer Memorial Hospital. And as you may have heard, there was a contest in the county to come up with a name, and some people up in one of the towns came up with that name. Okay, so you have a hospital that is maybe 2.5 times as big as the McGregor Hospital. And it can hold 6 or 7 doctors instead of 2. It's not going to have dentists. And it's going to have room for maybe 20 people in the hospital, 20 patients in recovery. The doctors, in hindsight, it was a pretty limited view. There was one hallway. But nonetheless, it was a substantial building designed for a hospital. And they consulted various people and got ideas on how to build it, whereas the McGregor Hospital was a house reconditioned to try and fit the medical needs. So the Pioneer Memorial Hospital was a fine step. But then eventually the city grows and grows, and the county grows. Now we're still, in our days terms, we're still, only 20,000 people in the whole county. But nonetheless, they had to come up with the idea of a whole new hospital. And bless their souls, they decided to tear down the Pioneer Memorial Hospital, not just add to it, but build a whole new major building on that very site. The church was kind of influential because the church leaders suggested to them that they take the whole block. It's just kitty corner from the temple. So when the Pioneer Memorial Hospital went in, they controlled the whole block, and that was with a vision of growing. So the county built a major hospital and got national architects in on it and went in to get $500,000 from the government, and it was I think the cost was $500,000 as I remember, and it was a serious hospital, and it did the community for 20 years, whereas the Pioneer Memorial did it for 40. Now wait a minute, I think the McGregor Hospital did it for 40, and then the Pioneer Memorial did it for 20, and then they added to that. And then they added to that, and then they added to that, and then they finally said, we've got to think bigger.
Okay. Can you talk a little bit about the community support of McGregor Hospital and in building the memorial?
You see, the McGregor Hospital had no community money in it. It was a private venture. Now, if you look at hospitals throughout the United States, they kind of fall into 2 categories, private hospitals and public hospitals. So the McGregor was a private hospital. When you go to the Pioneer Memorial there, you're talking about a public hospital. And so how is a public hospital going to get funded? Every time there is an expansion of the hospital, that's the fundamental question. There need to be two questions. One is, what services are we going to offer? What are we going to be adding? And the other is, how in the world is it going to be financed? So now this is a national issue. And so the federal government is in the business of making funds available for hospitals. But they don't intend to pay the whole cost. So they will come up, what was it, the Rudman Act? They will come up with a portion of the fund, because the federal government does not want to administer this. A hospital is a local thing. The federal government doesn't want to be in the medical business that way. So it's got to be a local thing, but the federal government wants to come up with enough money that the local people can do it. So you get federal money. Then the question is, are we going to have a county tax or a bond? But even if we do, in order to get a bond, you've got to convince a bank that there's enough donors in the community that this thing is going to work, that the bond can be paid off. And so there had to be support. Well, who's the obvious major donor? The church. And so when this new hospital is going to be built, the church does come up with a donation, and then when it's expanded, they come up with another donation, and then when we finally get to the final end, it's a big thing. So there were small donations by individuals, like $1,000, which was a big amount of money in those days. But the federal government, the county taxing capacity, and the church is how these buildings are funded, one after the other after the other.
You kind of mentioned before that it was the hospital was kind of the centerpiece of the community, and people kind of rallied around it, and it helped the community. Could you talk a little bit about
that? Now, I've done this research on what life was like and what people saw. So in 1900, the people were not doing hospitals because there was no hospital. Okay, you get the McGregor Hospital. Only in rare cases do people come to the hospital. But by the time you get the Pioneer Memorial Hospital, it's normal to go to the hospital for a birth. But until then, all the people are born at home. So once you get to the Pioneer Memorial Hospital, that means people are going to have to come from Virgin and Grafton and Enterprise and Panguitch and Bunkerville to the hospital. And, until 1930, you don't have very good automobile possibilities. And there's endless stories of people coming on wagons 8 hours to get to the hospital. And oftentimes the baby's born on the way. We still have that happen. But so the adjustment of looking to the hospital for your health care as opposed to doing it at home or getting the doctor to come to the home is a big difference. I can remember as a boy that the doctor came to our house. We didn't go to the doctor's office. The doctor came to our house. Occasionally we went to the doctor, and if we had to have our tonsils out, then we had to go to the doctor's office. My tonsils were done in the doctor's office. I'm really old. But the transition to hospital care was step by step.
Would you say that the growth of the hospital was an important part of the growth of the community?
Oh. It's symbolical of the whole history of this community, but all I can tell you is that if you compare this community with some other communities, it's just unbelievable. This has become a capital, and there are several reasons, but the hospital is the greatest thing we have. Everybody is proud as can be of the hospital, and you got to know darn well that we didn't raise all the money. There was a lot of hard work to raise money locally, but it was very big financial arrangement that made this hospital possible. And at least 85% of the money came from outside the community. And so this is you know, there's two capitals in Utah. Actually, there's some other fine hospitals, and the one in Provo is ahead of us. But gee whiz, well, this hospital makes us the capital of Southern Utah, no question about it.
You think we need anything else, Ian?
I think you covered it.
9,000 people in the county in 1952 when that big hospital was built. 9,000 people.